The infected tick has bitten Evan, and he is now infected with Rocky Mountain spotted fever, but he doesn't know that yet. Rocky Mountain spotted fever is a bacterial transmission of Rickettsia rickettsii carried through ticks. It is transmitted when the tick either feeds on the blood or is damaged through improper removal. Rickettsia rickettsii enters the body through the endothelium of the blood vessels. Typically, after someone is bitten by an infected vector, they don't realize until 2 to 14 days after the exposure. 3 days after Evan's exposure, he begins to show a rash and other symptoms of Rocky Mountain spotted fever.
Do you understand this problem?
Let me see.
I just don't understand it.
Yeah, so pretty much you just,
Do you know that you have a rash?
what is that?
Yeah, you should really go see a doctor, I think.
You think so?
Yeah.
I mean, obviously I have a rash, but I've also had fever, muscle aches, headache, a loss of appetite, and chills. That's actually why I'm wearing this sweatshirt.
You know, I was wondering, it's really hot today.
Yeah, I promise I'm not weird.
After speaking to a classmate, Evan decided to go visit a doctor.
Cool, doctor's office.
Hi, Evan. I'm Dr. Webb. What's going on today?
So I have this rash, and I've also been feeling nauseous. I've been vomiting a lot. I'm very tender. I have a really bad stomach ache, and my rash actually has been spreading
Spreading where?
to my ankles.
Oh. So can I see your rash again?
For sure.
So this is a unique rash, typically with Rocky Mountain spotted fever. But the only way to truly confirm that this is Rocky Mountain spotted fever is taking a small blood sample. Would you mind?
I guess not.
All right. So we'll get that done in a second. So typically if this is Rocky Mountain spotted fever, you want to avoid vectors that are carrying the pathogen, so like any infected ticks. And whenever you go in the woods or forest or fields, you want to wear protective clothing, such as clothing that you can tie around your ankles and your wrist so ticks can't find a way to your skin. But this is typically treated with doxycycline. So I'll write you a prescription for that and you can go speak to your pharmacist.
Sounds good. Appreciate all the help.
Have a great day. After Evan's trip to the doctor, he is officially diagnosed with Rocky Mountain spotted fever. The doctor took a blood sample and ran a standard serologic test. The test is called the Indirect Immunofluorescence Antibody Assay for immunoglobulin G using our Rickettsia antigen. It was due to this blood test, the unique rash, and his other symptoms that he was able to be diagnosed with Rocky Mountain spotted fever. It is very difficult for the body to rid itself of this gram-negative bacteria because it lives intracellularly and causes internal damage to cells. The lining of blood vessels are also damaged, therefore allowing the fluid to exit these damaged capillaries. This causes the swelling of tissues and the unique rash. This is typically treated with doxycycline, which is what the doctor prescribed.
Hi, how are you?
Good, how are you? Just dropping off.
Okay, doxycycline.
Yep.
All right, doxycycline is a class of medications called tetracycline antibiotics. They work to treat infections by preventing the growth and spread of bacteria. And the drug diffuses into the host cells and inhibits the intracellular pathogen to carry out protein synthesis. You should take a 100 milligram tablet every 12 hours, and it should be taken for at least 5 days. And even when your symptoms reside, you should take it for an additional 3 days.
Okay.
Do you have any questions?
I do not.
Okay, here you go. Have a great day.
You too.
Evan was counseled on doxycycline. Doxycycline belongs to a class of medications called tetracycline antibiotics and is used to treat infections by preventing the growth and spread of bacteria. The drug diffuses into host cells and inhibits the intracellular pathogen to carry out protein synthesis. Evan was instructed to take a 100 milligram tablet every 12 hours, but if Evan was a child or under 100 pounds, he should take 2.2 milligrams per kilogram of body weight every 12 hours. Lastly, he was reminded to continue taking the medication even after his symptoms reside.
Oh wait, should I sit by you today? I'm not really sure with like your whole rash thing.
Yeah, you know, it turns out it actually wasn't contagious.
Really?
Yeah.
Okay, great.
Evan now takes proper precautions when going into the woods, such as wearing protective clothing, spraying tick repellent on himself and his clothing, and checking for ticks immediately after being in areas that could have ticks.